This video will review wounds and basic post-operative complications in preparation for your general surgery shelf review. There are various types of wounds. To start, clean wounds arise from sterile, non-traumatic fashion, an area free of pre-existing inflammation. Think respiratory, genital, urinary, not entered. Everyone in the surgical case follows strict aseptic technique. Clean contaminated, this is the respiratory or genital urinary tract that was entered but no specific spillage like feces, for example, has entered into the site. There is no established infection, although there may be a minor break in aseptic technique. An example of this type of surgery would include cholecystectomy with an open lumen. Contaminated cases have gross spillage from the GI tract or the GU or biliary case, where the tract was entered in the presence of local infection, think cholangitis, or there's a major break in aseptic technique. Cases include colon resection during anastomosis without clean bowel prep. Dirty wounds are a result from remote trauma and contains affected tissue or purulent material. There is an established infection or perforated viscera prior to the procedure. Wounds in the thoracic, cardiac, neuro, breast, ophtho, and ortho regions, you need to consider Staph aureus and Staph species. For surgeries including appendectomy, colorectal, biliary, OB/GYN cases, and urological procedures, please consider gram-negative and anaerobes. Animal bites, think Pasteurella, strep, and staph. Now that we have reviewed the types of surgical wounds, we need to address post-operative wound care. If you see a salmon color drainage from the operative site, think about fascial dehiscence. If your sutures are busting open greater than 1 centimeter width, think about herniating viscera. Peritoneal signs include a rigid abdomen, tenderness with or without rebound, and involuntary guarding. Patients with an acute abdomen need to go back to surgery immediately. This is very high yield. If someone has an acute abdomen with blood in their stool, think about mesenteric ischemia. If there is evidence of an acute abdomen with blood in the urine or profound back pain, think about a ruptured abdominal aortic aneurysm. A less tested but possible exam finding is something called the Kerr sign. This is where a patient will get referred pain to the left shoulder due to irritation of the left hemidiaphragm. This is seen with splenic rupture and residual pneumoperitoneum after laparoscopic surgery. Now that we've reviewed wounds, the types of wounds, and post-operative complications, I want to review the 5 W's, or the 5 etiologies of fever. The classic training and mnemonic to consider fever in the post-operative patient includes the obvious cause, the wound. Wind includes atelectasis. Water, consider urinary tract infections. Think of this little walking emoji to consider the etiology of fever from a deep vein thrombosis and or pulmonary embolism. The last W to consider includes wonder drugs, typically associated with sedatives and induction agents surrounding intubation. This concludes your brief overview for wounds and post-operative complications for the general surgery shelf review. Please comment if you have any questions, and thank you so much for your time.